The craze for fiber-enhanced foods has swept across supermarket aisles so quickly that it's hard to find a product without a good source of fiber badge these days. Cereals, yogurts, granola bars, cookies, tortillas, protein shakes, even sodas now boast added inulin, resistant starches, soluble corn fiber, or chicory root fiber. This fiber frenzy isn't happening by accident. It's the collision of genuine nutritional gaps, consumer demand for digestive health, and food companies racing to meet that demand with convenient, functional additions. And while the trend has sparked some justified skepticism, the deeper story is actually more reassuring. Most Americans do need more fiber, and supplementation is often safe, helpful, and far from excessive when done thoughtfully. But it's equally true that more isn't always better, and overdoing added fibers can introduce discomfort that undermines the benefits. Most people underestimate how wide the fiber gap is in the United States. National surveys consistently show that the average adult consumes around 15 grams of fiber a day, barely half of the recommended 25 grams for women and 38 grams for men. These targets aren't arbitrary. They reflect levels that support smoother digestion, healthier blood sugar regulation, improved cholesterol, a lower risk of heart disease and colon cancer, and better appetite control. The modern food environment, with its abundance of refined grains and processed foods, makes it surprisingly difficult to hit those targets without deliberate effort. That's part of the reason fiber supplements and fiber-enriched foods have surged. They promise a shortcut to help close a gap that truly matters for long-term health. Dietitians tend to agree that, in principle, boosting fiber intake is overwhelmingly positive. A day built around whole fruits, vegetables, legumes, nuts, seeds, and whole grains naturally meets fiber needs and provides the vitamins, minerals, and phytochemicals that isolated fiber additions can't replicate. But they're also realistic. People are busy, habits are entrenched, and food preferences vary. If adding a fiber-fortified yogurt or choosing a bar with extra inulin helps someone move from 10 grams a day to 20, that's meaningful progress. Dietitians often describe added fiber as a bridge, not a replacement, a practical tool to help people ease closer to healthier patterns without requiring a full dietary overhaul all at once. Where the conversation gets complicated is not whether Americans need more fiber. They do, but whether the current wave of fiber-enhanced products is always helpful. Many added fibers, especially inulin and certain oligosaccharides, ferment rapidly in the gut. For people used to higher fiber intake, suddenly consuming several fiber-fortified foods in a day can lead to bloating, gas, and abdominal discomfort. This doesn't mean these fibers are harmful. In fact, they have prebiotic benefits that support a richer microbial ecosystem in the colon. But the gut adapts gradually, and increasing intake too quickly can overwhelm the system temporarily. Dietitians frequently emphasize the importance of pacing, adding one new fiber-rich food at a time, spacing fiber throughout the day, and increasing water intake to help smooth the digestive process. Excessive supplementation, truly over-the-top levels of 50, 60, or 70 grams of fiber a day, remains relatively rare. Most people simply don't reach numbers that high through processed foods alone, and those who do are often consciously experimenting with fiber for satiety or glucose control. But even at moderate levels, stacking fortified foods together can push added fibers into uncomfortable territory. A breakfast cereal with 10 grams of added fiber, a shake with another 8, a bar with 5, and a high-fiber tortilla at lunch could unknowingly create a 30-gram added fiber load before dinner. For someone whose baseline intake is 12 grams a day, that leap is bound to cause digestive pushback. Dietitians don't discourage these foods outright. Instead, they recommend paying attention to tolerance, dialing back when needed, and gradually building toward higher intakes using a mix of natural and added sources. One of the more positive aspects of the fiber trend is that it has raised public awareness of digestive health to a degree previously reserved for protein or calorie counting. People are talking about gut bacteria, resistant starch, and short-chain fatty acids in ways that would have been unthinkable 15 years ago. This shift helps normalize conversations about bowel regularity, bloating, and diet in general, topics that are often stigmatized despite their profound impact on quality of life. And for individuals who struggle with constipation or who eat a low-variety diet, supplemental fibers can be an accessible, affordable, and low-risk intervention that makes a tangible difference. Still, the most important message from nutrition professionals is balance. Fiber-enriched foods shouldn't crowd out the whole food sources that bring broader nutritional advantages. Fruits, vegetables, oats, beans, lentils, chia seeds, and whole grain breads offer not just fiber but phytonutrients, antioxidants, minerals, and textures that support satiety and satisfaction. Fortified products are best seen as supportive tools, convenient ways to fill gaps on busy days or to help people transition to better habits. And spreading fiber across meals, drinking enough water, and introducing new sources gradually can help most people enjoy the benefits without the bloating. So, do Americans really need fiber in everything? Not exactly, but the rising availability of fiber-fortified options reflects a genuine population need and can meaningfully improve health when used sensibly. The key is thoughtful integration. Rely on whole foods as the foundation, use fortified options to fill gaps, and let your body be your guide. When approached with awareness rather than excess, the fiber frenzy isn't a fad to fear. It's a trend that can nudge the population toward better digestive, metabolic, and cardiovascular health, 1 gram at a time.